Hello, and welcome to yet another episode of the International Care Collective, the podcast with University Hospital Sussex and NHS Stay and Thrive Community of Practice. As always, I'm your host, Sam Elliott-Aleknovich, and today we're going ever so slightly off-piste. We are normally the podcast that brings you information and people bringing their stories about travelling from overseas to join the NHS. However, today, as we're with Stay and Thrive, we have Stay and Thrive with us. Please welcome Victoria and Mark. Welcome to the podcast. Thank you ever so much for joining us. We really appreciate it because you've travelled quite far today, haven't you?
From the north of England. Deepest, darkest north.
Yeah, the
Sheffield.
Deepest, darkest north. You say that like it's so far away. But to be fair, what was your journey like?
Well, it's about three trains, it is quite a way away.
Little bit of a way away, and someone's travelled a little bit further.
A little bit further, so I came from the Far East. I just happened to visit my family in the Philippines and also had a side trip in Japan.
Amazing.
And arrived last night and stayed in London, and now I'm here.
So remind us what time it is for you at the moment, Mark.
Probably around 7 p.m.
7 p.m. So we're getting there. More coffee later. But again, thank you so much for joining us. We do really appreciate it. So first of all, just tell us a little bit about yourselves as you're close to Victoria. Let's start with yourself, Victoria.
What would you like to know? So I'm Victoria. I'm a nurse by background. I've done all sorts in terms of my professional career and worked kind of all over the UK and Northern Ireland, and I came to NHS England at the beginning of COVID to set up one of the Nightingale hospitals, and have worked in workforce probably for my entire career, so was very privileged to be able to set up the workforce unit in NHS England in North Eastern Yorkshire region, from which, as we started the international recruitment, we set up in collaboration with colleagues in the Southwest, Stay and Thrive.
Amazing. Thank you for sharing that, and go on.
So as for me, I'm Mark Doblas. I originally am from the Philippines and I arrived in this country about 7 years ago. I am a nurse by background, and I started off in an orthopedic ward, and then I dabbled into EDI and had a role in supporting internationally educated colleagues. So I went on to be supporting them in their OSCE training and in their transition to the country. And then I then became the lead for international recruitment in my organization, and then went on to join the Stay and Thrive team as a fellow at some point. And then from then on, I enjoyed working with internationally educated colleagues, making sure that their voices are heard, being part of the international recruitment and retention team. And now I'm working in NHS England to be the lead for Stay and Thrive.
Amazing.
That's me in a nutshell.
And how have you found it so far with obviously it's bringing everything together that you've, I suppose, worked towards, and we're working with Stay and Thrive. How have you found that so far?
Oh, wow. That's a very important question, because in my life, I've always been looking for ikigai. So if you know the principle, it's a Japanese principle that says if you're looking for a job, it has to be something that puts food on your table, something that you're good at, something that contributes to society, and something that you know so well. So those four, I think I've found that in Stay and Thrive. It's something that I'm very passionate about because I've lived the journey and I've seen how the plight of internationally educated colleagues have been, and the support that we have provided them all these years, and the change that we have seen so far from the very first diaspora into the UK up to this time. There has been a lot of improvement, but I know that we've come a long way, but there's still a lot of work to be done, and we're continuing that work through Stay and Thrive.
And it really is great to see, especially when we have the drumbeat calls, and we see all the work from all around the UK. It's great to see and have that shared knowledge base as well, which is just, such a joy to see. Even if it's just those half an hour snippets, but it's so much information, and we could use that here, that could be used there. It's really good. So again, thank you for the work that you guys do for Stay and Thrive and for the international staff across the UK. So one of our things here on the Care Collective is we ask you to bring something with you that means something to you, that's really important, that thing that if you go home or you've had a bad day or you've had something that you kind of go to just to make yourself feel better. So what have you guys brought together today with yourselves?
So I actually brought something, but last minute, just now, I decided to change it. So I brought something that is within my body. So it's inked in my right arm. It says, no matter where, and then there's a logo of a sun right next to it. I want to bring the sunshine everywhere I go. So I am an internationally educated colleague coming to this country in the dark, gloomy, grim October of 2018, I realized that I have chosen to come to this country to work for the NHS, and that's the weather that I've been introduced to. But I come from a tropical country, so I feel like no matter where I go, it's just about bringing that sunshine with you. So that's keeping me going every single time.
Amazing. It must be quite nice every time you see it. Probably just even just get a glint of it as well. So often it kind of that reminder.
Yes.
It's amazing. Yeah, there's no hiding from the weather in October, regardless of whether you are in the UK, I think, is there? So,
but we have a lovely weather today, which reminds me of home.
We're very blessed today with the weather.
It's also terribly British that we've started talking about the weather, isn't it?
Had to be done at some point, let's be honest.
Yes.
And Victoria, what about yourself?
So, don't know if you can see it, but this is my hospital badge. So I trained ever so long ago as a nurse up at St James's Hospital in Leeds, and that was when we did the old-fashioned apprenticeships. And I think I brought that with me because, one, I don't think you can ever take the nurse out of me. So I'm one of those people who, I suppose, growing up, always wanted to be a nurse. I'm very privileged that every day that I get to do what I do and make a difference to one or two people around me and collectively thousands and tens of thousands of others by making a real difference in terms of kind of what we do. So I think, one, it reminds me of what a privileged career I have, but also it reminds me what a really important job it is that we do each and every day. Yeah. And I think some days we all go home and go, what have we actually accomplished today? And sometimes, kind of given current circumstances, that can kind of be quite challenging. So I think it's really important to remind ourselves about not just why we're here, but why we chose to be here and why we choose each and every day to do what we do.
That's a really beautiful story. Thank you for sharing that. That's lovely. And it's true. I think I think not everyone gets to have that career where they get to wake up and actually know that they're going to go and enjoy the day, however awful it may be or however nice it may be. Even without that, you're already getting up knowing I'm going to go and love what I'm going to do today. So I think it's key.
It's a real privilege.
It is, and a lot of our people that we've had on the podcast have said a similar thing. They generally get up and know that they're going to go and do something that they love, and that is a key take home, I think, for anyone, regardless of your profession. So yeah, thank you both for sharing those stories with us. That's really, really interesting, and I'm sure a lot of people will take a lot of takeaways from that. So thank you. My next question for both of you. What has made you decide to work in the NHS? You've kind of touched on this a little bit. You've always wanted to be a nurse, but what kind of made you kind of say, okay, I want to stay in the NHS? Because there are obviously different avenues you go down. Why NHS specifically?
I suppose I've had a privileged career in that I've worked outside in industry and I've worked in education as well. But why the NHS? I think we have a real responsibility to be able to shape our care provision, to be able to support the communities around us in terms of not just their health and well-being, but also as anchor institutions, the NHS gets to impact on some of those other elements of health, so deprivation, kind of well-being. So for me, being in this job, the kind of my other passion is around that widening access and making sure that people have an opportunity to be privileged and to work and to do the things that they love, and nobody should not have that opportunity. So for me, when there was an opportunity to work within the workforce unit and set that up, and not just recruit some of our fabulous international colleagues, but look at that kind of retention element, but also to work with our entry careers, so our healthcare support workers, our AHP support workers, and work with our schools and our young people to encourage them to come into a career. And I don't think you could do that anywhere else than NHS England, so it's a real privilege.
That's a lovely answer. Same question to you, Mark.
So ever since I was a kid, I've always known I wanted to be a nurse, probably because I have a very good role model, as my mom is a nurse as well. And I've always liked caring for others. I've been cared for by my grandmother, and I had the privilege to look after her before she eventually died. And then, so that's set in stone. I really want to be a nurse. Yeah. I wanted to work in the NHS because I've always been fascinated with the care system in the UK, because it gives me that very stark comparison with where I came from. Healthcare in the Philippines is not it's not a right. It's more of a privilege for those few who can afford, because it's not a public system. And I just wanted to see how it works out working in the NHS, being a nurse, that you would be able to provide the best for your patient just because you have that opportunity to work in a system as huge as the NHS. So I've always liked that, plus the fact that I really wanted to meet the Queen at that time. I didn't have the privilege, but because of the work that I do, I had the privilege to meet the King instead. Yay. So, yeah.
Well done. That's a really nice story. And how was that, obviously comparing the two systems, how was that kind of in your head compared to you? Is there things that you think, why aren't we doing this?
Yeah. Oh, wow. It's a huge paradigm shift for me, I would say, because I've always been so used to, when you get into the hospital and then you pay for the service, when you get out, when the patient gets out of the hospital, it's no longer part of the responsibility. So if something happens to them, it's up to them to access the care again and pay for it. But if they don't, then they'll be left out there. Whereas in here, you know that from the onset to wherever they go and whatever may happen to them, you know that you can bring a very good service because it goes around and then they come back to you for that care. So if the care that you provide from the onset isn't that great, you know that at some point they'll come back to you in some instance. Yeah. So I like that perspective, that I'd be able to give them the best quality of care, making sure that they wouldn't, as much as possible, access it because of the poor quality.
Yeah. And I think I always say we are so very lucky in this country that is the case. It's like, we have that option. And when I speak to our international colleagues where that isn't the case, it kind of makes you feel a little sad. I don't really agree. It's like we're very privileged in a way, I think, in terms of this.
I think, like I say, it goes back into that kind of community kind of focus, doesn't it? Yeah. That no matter what the nature of your illness or disability or condition, you can get the right care at the place that you need it.
Yeah, and at the time that you need it most as well, isn't it? And it's so important to have. So thank you both again for sharing those stories. We're going to go on to about Stay and Thrive, because that's what we're here to talk about. We are here to talk about the amazing work that Stay and Thrive does. So just for our viewers and our listeners, can you just tell us, start at the very, what is Stay and Thrive? What does it do for the community here in the UK?
Stay and Thrive for me is a coming together. It's a social movement. It's an opportunity to share. That for me is Stay and Thrive. Stay and Thrive has grown to become a platform where everyone who somehow in different parts of the country, in different NHS organizations, go through the same challenges and are able to pick up best practices from those that have been through the same challenges and work that and pinch that with pride, be able to create something that's tailored for them in order to address the situations that they're facing. I think that it's become a very strong social movement to be able to harness the power of that community, to be able to find solutions where you think that there wouldn't be any, and also be very creative of what we're given and what we have. And it's grown massive. I think that it's helped so many in so many professions, so many hospitals, and it's still helping many other components of the care system. I can talk on and on about it, but I'm sure Victoria has something to say on the more technical side of Stay and Thrive, but that's how I feel what Stay and Thrive is.
Yeah, so I kind of mentioned it a little bit earlier, but just I suppose before you go, what is it? It's that important bit about kind of where did it come from. Yeah. So for me and for my colleague Ed Cox and the NHS Horizons and team who worked with us to kind of develop it, it was that recognition right at the onset of our work in terms of international recruitment, be it nurses, midwives, allied health professionals, doctors, scientists, you name it. There are over 200 nationalities working within the NHS. But it was that recognition that we can't actively recruit from other organisations without ethically, morally, and from a conscience perspective, thinking about how do we not just retain them, but support them in their aspirations to be who they want to be and to kind of reach those personal and professional goals. So Stay and Thrive came about, as Mark's described, I suppose more than just a social movement. I say just a social movement, more than a social movement, because it recognised that how do we start to shift some of that control? How do we start to make the colleagues who are internationally educated, those colleagues that work closely with those in kind of recruitment, retention, education, kind of workforce spheres, able to take control and be those social change agents, rather than normally change happening because it's a hierarchical step down. So for us, it wasn't just about recognising the importance, but how do we create something that is embedded, that is sustained, knowing what we know in healthcare, in that the best ideas often come from those that are involved in that work and the experience and lived experience. So it became about how do we recognise, how do we draw from the experiences of colleagues and use them in a way that helps to build some of that improvement and build some of that change, and really challenge some of the hierarchical held beliefs. So where not only do we kind of, I suppose, support at the point of care and support our colleagues who've journeyed here, we're not above challenging even very powerful individuals about practices and how they're not sustainable and how that culture's not a great one to work within.
Yeah, and I think you've both touched on valid points. I'll touch on the one that you brought up first, is that sharing. It kind of brings together that sharing is caring. For me, every time that we go in there, I'll learn something, and it's rather than people reinventing the wheel, it's like, this is here. If you can use it and develop it into something that would be relevant for your areas. Because, the UK, I suppose, however small we are in comparison to other countries, the region will vary in terms of day-to-day living and the communities that live in those areas. So something, for example, that we're doing here in Sussex may not be relevant, but you can still take the bits that would be relevant and use that. And I think what you were saying about the hierarchical thing, it is still a lot of our international staff, it's so ingrained from their training. I mean, correct me if I'm wrong, I'm going from what obviously the conversations that I've had with our international staff, they find it hard to break those barriers. It's not that, and especially that interprofessional working, that multidisciplinary team working, it tends to be the biggest barrier that they struggle with when they first arrive. I always say to our staff, you've not got on a plane and forgotten how to do your career. It's the system that you're working in is the polar opposite to what you're familiar with, and that tends to throw people off more. Is that right? Would you agree? I mean,
yeah, absolutely. I think that if you come to think of it, those internationally educated colleagues come here with wealth of knowledge and experience. They don't start as a newly qualified professional. They come with loads of experience in different care systems in fact. But when they come here, they need to go through the process of learning, relearning, and unlearning because of it's so ingrained in them. I think I always say this, the paradigm shift is very important. That's why we have to be there to support them because the system that they may have been working with previously may not work the same way as how it is in the UK. Say, for example, in nursing, most of the countries we recruit our internationally educated nurses from have a model of very medical-led system. And when coming to the UK, it's more of there's a degree of independence and autonomy that's given to the nurse, which, in fact, in those countries where they come from, they don't. So if you look at it, they're very skillful, but they have to see what's in the doctor's notes in order for them to perform it. But when they perform it, they're very skillful. But then when it comes to having that, I'm not saying they don't, but I'm saying that it is to be ignited in them. Say, for example, critical thinking and having to make that decision, having that decision making. They have it in them, but it's just about bringing the best in them to be able to perform that.
Bringing it out in them a bit more, isn't it? It's there. It's just.
But I think it's so much more than that. We don't as a country live in a nice isolation, do we? And the UK doesn't have the caveat on all the best international practice. So the more we work with our internationally educated colleagues, irrespective of discipline, we start to understand that there are perhaps other ways that we can improve our healthcare. So if we look at some of our midwives that have maybe come from our African nations, many of them will practice really independently, or even some of our kind of nurses in community settings where there isn't that medical model, and will kind of have to work with huge amounts of different initiatives and different factors to able to kind of deliver care. We work with models, for example, in the Philippines, much more public health orientated, isn't it? So if we think about our world at the moment in the NHS and that shift, that triple shift in terms of from hospital to community, from analog to digital, here we are today, and from illness to prevention, some of that public health understanding that our international colleagues have, or our community understanding that some of our international colleagues will have, help lay the bedrock for huge changes, I think, going forward.
And I think that's the beauty of Stay and Thrive as well, because we get to understand exactly how our internationally educated colleagues can contribute well from where they come from, bringing their whole self, their expertise, and the knowledge of the system that they come from in order to provide that knowledge and information to the NHS to somehow augment, make it better. Yeah.
I think some of our work, as many organisations did right at the beginning, focus very much on the stay bit and how do you do that well. And I think what we've seen over the last 18 months, 2 years, is we're growing more into that kind of thrive bit.
Yeah.
So not only do we help support colleagues in that kind of transition, as you said, Mark, being able to think and kind of bring together some of the work and help them think about how they progress. But really importantly now, how does that benefit us as an NHS? How do we change our systems? What can we learn from our colleagues in terms of how we shape our services? And I think the model that we've used around positive deviance very much shifts that balance in terms of it's not hierarchical led. So organisations have already got all of the factors, all of the experience they need to start taking, again, not just from internationally educated colleagues, but from all the colleagues in organisations to start thinking about that kind of triple shift and encouraging some of our international colleagues to maybe lead on some of that work.
Definitely, and I think for me, even when I'm working clinically, it's great to be, I find it great to be challenged, especially by our international staff at the beginning, because they're seeing us do certain things and they say, why are you doing it this way? And I always try and go down that road. How would you do it at home before? Because there may be something that we're not doing that they may have done, regardless of, again, professional where they've come from, but might actually be good practice to kind of take on board if there's obviously rationale to back it up.
It's the evidence base behind the practice, isn't it? But also the evidence base behind the how, not just the what.
Right. There's been some great research done from StayandThrive with the University of Huddersfield, is it?
Yes.
I always get that confused in how I say it around, but I know that they've done some great work. Could you share with us and the listeners a little bit about what they've gone into?
There's kind of five pieces of research. One was kind of some of the factors around around the migration and kind of what did that look like. There is some research, some really, I suppose, challenging research on cultural sensitivities and the experience of internationally educated colleagues in a kind of variety of different ways. And then the most important research for now that we're doing, because much of that was based right at the beginning of the N50K work, although it's applied across all our professional groups, a lot of the work was based on kind of the experience of nurses. So we're and some with midwives, but we're starting to do another collaboration with the University of Huddersfield at the moment that looks at the experiences directly of allied health professional colleagues as well. So what that will give us is that huge body that helps us understand why people migrate, what's important to them in terms of the factors around that migration, and really importantly, what's keeping them here and what those experiences that are kind of playing through. Why is that important? Well, we've invested millions as an NHS in bringing some extremely talented, highly qualified individuals across here. If we don't look after our staff well, colleagues will choose to migrate elsewhere, and clearly we want to keep fabulous, talented people like Mark within the NHS. So I think that's really important. And I guess for me, recognising that we have a marriage of international communities in the communities that we serve, our population in our organisations need to reflect that. So University of Huddersfield's research starts to reflect through all.
I like the way that you've hit on it, how important it is that we learn from it and learn from these brilliant people like Mark that we are bringing in and learn how they and what they need, because we don't necessarily know. We can, I suppose, guesswork when we're doing all these things in the beginning, but we need to learn from the people that have that, like we said, lived experience, don't we? Now we move on to my favourite part of the podcast. So can we have the music, please? So here we are at the Board of Joy once again. We are keeping this, even though we've gone off piece for this episode, we're keeping this in just to throw Mark and Victoria a little bit of a curveball here. So on the lovely Board of Joy behind you, you can see we have all of these cards here. What I'm going to ask each of you to do is we're going to get pick 2 cards each, pass them over to me without peeking, and I will ask you the questions that are on those cards. So at your will, please feel free to pick a card, any card. Pick 2 each, please.
This is the moment of
Indeed.
truth, isn't it, Mark?
We almost need a drum roll here.
It's quite worrying about what we picked.
Yes. What have you picked? What have you picked? You've answered this a little bit already, but I'm going to ask, and again, just add to what we've said already. How does Stay and Thrive connect with existing talent development or career progression programs within the NHS?
One of the things that we've absolutely reflected, and Mark's already mentioned it, that many of our international colleagues have years and years of experience. Listeners might be aware that there's a myriad of programmes through NHS England and more locally in terms of leadership development and talent development, particularly things like aspiring deputy directors of nursing programme or aspiring AHP leadership programmes. So there's much that we've learned that's kind of factored through, particularly in terms of the EDI profiles and thinking about how do you feed cultural sensitivity and cultural understanding through into your leadership programs, and not just assuming that somebody, for example, who doesn't make eye contact with you is being a bit shifty, actually recognising it might be being done as a courtesy. So there's kind of, I think there's factors around the kind of cultural sensitivity.
I think it's very important to acknowledge that talent pool, and in supporting that talent pool, there's the career development piece of work that we're doing, because if we align it, if we look at the University of Huddersfield research on motivations for migration, 26% of the respondents say that their motivation for migration is to progress in their careers, but it doesn't reflect in what we see in the landscape. So if we look at that, there is that support that we need to provide them in creating that career development piece. The career development piece, as we know, it's just about navigating the system within the NHS. How do you apply for the job? How do you write the supporting information? But more importantly, actually, it's touching on the cultural aspect as well to begin with, because if we look at our internationally educated colleagues, if you ask them, the way they do their recruitment is totally different from what we do, which actually we can learn from as well. But of course, there is that shift that they need to think that they come here and they actually need to put themselves forward, because there's so much that they can share, rather than just them coming here to be part of the workforce, just silently do their jobs, when in fact they actually bring so much. So there's one thing that we're already doing at the moment, which we call Step Up, Start to Elevate Your Professional Career. And that's geared towards supporting Band 5, 6, and 7 in their realization of their career currencies and how they can work towards getting the career that they want. And of course, also being able to do the career that they already have been doing back home, and just be able to bring that knowledge and contribute into the system. And we're also looking into creating that step up further. This is geared towards Band 8As and above, because we acknowledge that this is a whole different ball game for them. And there's a lot of different support that they need in terms of that. So we have a lot of different programs, and that's one that I can mention in terms of tapping in those talents.
Most organisations have got some form of reciprocal mentoring going on. So for me, the direct link, which I think is what you asked us, is you know, how do we link some of those programmes into those EDI initiatives, such as reciprocal mentoring, so that we get a better understanding of by people, of colleagues, and their kind of cultural sensitivities across wider organisations, because that will not only play through to better leadership within the NHS, but play through to better care.
In what ways does Stay and Thrive address the unique challenges faced by staff from ethnically diverse or underrepresented backgrounds?
There's a lot, and I think Stay and Thrive is the conduit from understanding what it is like with those coming internationally with their lived experience, and then how, as an NHS, can we support that?
Yeah.
So say, for example, preceptorship. So they come with wealth of knowledge and experience. They don't start off as a newly qualified registrant. So there is that gap that we found that we need to support with. And say, for example, the experience of menopause and how different are the challenges they have in terms of neurodiversity as well. It's an added layer of challenges that they have. So how, as an NHS, can we support that in a way?
And often when we think about immigration and we think about international recruitment, we think about that in a proactive way. That's something that we've done. We forget about forced migration. And we have large numbers of colleagues from the global majority who have been refugees or who are asylum seekers, so in the country for kind of all sorts of political and other challenges that have brought them here. Our work is not just about looking after those that have actively chosen, it's looking after those colleagues that have had to run and flee from kind of war and kind of other elements. So again, understanding some of those experiences in terms of our refugees will feed through in some of our most deprived communities. But not only that, recognising that there's a wealth of talented, knowledgeable individuals within that. So how do we support, again, thinking about this on a bigger scale and not just health, how do we support those talented individuals who are sat in those refugee communities who absolutely want to make an impact?
How are local organisations, including the NHS local organisations, being supported to embed equity, diversity and belonging as part of the retention efforts from Stay and Thrive?
There's a real focus on colleagues from the global majority and how do we really challenge ourselves in terms of our race equality scheme data and whether that's kind of reflective in terms of the progression mark. You cited 26%, I think, wasn't it? A kind of around some of that. So there's a huge amount of work around race equality going on. But I think it's also closer to home. So I mentioned reciprocal mentoring.
Yeah.
I think the more we understand colleagues from everywhere, doesn't kind of really kind of matter where that is or kind of what professional base that is, that the better we're able to kind of provide care. So we're starting to see some of that equality work play through, certainly in the work that's undertaken with students in undergraduate programmes, whether that's through preceptorship as well as kind of some of the career development opportunities.
Yeah.
I feel like each local NHS organization has something to offer. There's already something that's embedded to support them. And as a Stay and Thrive community, it's also about highlighting the best practices that they have, showcasing them, and ensuring that we give them the right platform for others to be able to see the good works that they're doing, and for other organizations at some point to be picking up on those best practices. It's been a wonderful journey knowing that when you start to develop something in order to address, in order to be part of the solution to the certain situation that you're faced with, sometimes you don't really get to see what more is there, not until someone from a different local organization would be able to highlight that. And then that's when you get a light bulb moment and think that, oh yeah, that's actually something that's also very much doable and applicable as well. Or sometimes it's also a matter of reflection for them to be able to see that I don't think it's going to work within our locality. And that's where Stay and Thrive comes in, to be able to give them that platform, to share that space for them to be able to hear each other and to gather information from each other.
How does the work that Stay and Thrive do align with the NHS England's long-term workforce retention strategy?
So I think kind of lots of ways. We know right at the beginning we couldn't recruit our way out of the workforce challenges for the NHS. I've already said, there's over 200 nationalities within the NHS. The NHS was built on an international community in 1947. We've seen the Windrush generations, we've seen all through there. So, that in itself gives that kind of longevity around the kind of international community that is the NHS. I think going forward, retention has to be absolutely pivotal. The work that we do in Stay and Thrive isn't just around international retention. It's about helping colleagues such as yourself, colleagues that are listening to this, recognise the really great practices that might not just apply to internationally educated colleagues, but apply across the board. I think the other thing that we do is give people a skill set to be really, really positive change agents, and to think about how do we kind of challenge some of that. So for us, it's not just about the importance of Stay and Thrive in that retention agenda. It's also about how do we create colleagues that are able to think about change positively, to see really, really great initiatives and go, that's a brilliant idea. How do we use that to make a difference here at home?
100%. I think it's one of the things that I realised early on in my career, especially here, is when we were developing what I call my pastoral support Bible, is realising actually this would work for anyone, not just international staff, but people that are coming, because not everyone was born and raised in Sussex. So anyone that's joining the trust from not necessarily Sussex or the local area would find that really beneficial. And we've now actually used that as part of our induction for all staff.
It's amazing to see the amount of benchmarking and the amount of sharing of the practices from across the professions, from across the world, from wherever you come from across the level of careers that you may be in. There's a lot that we can pick up from and learn from and transpose that into whatever is suitable for you. And that is just an amazing platform that we have in Stay and Thrive.
If you think about when you were first starting this journey, or for yourself, Victoria, when you started getting into international recruitment as a whole, if you knew then what you know now, what would be your best piece of advice for someone considering doing this journey of international recruitment? So leaving, if it was chosen or not, what would be your best piece of advice?
On a lived experience level, I would say that they shouldn't be apologetic of what they can offer, and they should be proud of putting forward their thoughts and their ideas. Some people, because of the cultural background that they have and the shift in their mindset, they tend to shy away from sharing those ideas, when in fact, don't be shy about it, because it's something that we can learn from. And I think on a system, organization level, it's more about ensuring that we keep beating the drum of retention and keeping that support alive and kicking, because we would need it in the sooner years to come, I would say.
When do you feel it's right for someone to stop being referred to as international?
Do you know, it's interesting, isn't it? Because there's two ways of looking at this. You can look at it and treat it kind of really negatively, or you can look at it and treat it and recognise that actually being internationally educated brings with it a knowledge base and a huge understanding that perhaps needs to be recognised. It's the context, I think, within which you use it. Yeah. Somebody who's internationally educated will always be internationally educated, but that shouldn't limit the opportunities both that they believe they have and that within the infrastructure that we create, we enable them to have.
As for me, it can go two things. It's a celebration of your heritage. It's also a celebration of your hard work. Once you also have received your registration or your qualification in this country, you can proudly say that you are a nurse in the UK, because that's a celebration of your hard work. Yeah. But through and through, within your heart, you know that there is that celebration of your heritage. Yeah. So as fluid as it can be, you can always call yourself and be proud to be a nurse or to be an AHP, to be a midwife. Yeah. But in your heart, you can always, at whatever point in time, call yourself an internationally educated colleague as a celebration of your heritage.
Yeah, part of you, but it doesn't define you, does it? That's the thing. Yeah. I think that's the most important thing moving forward is, you know, we still celebrate these wonderful people that are making our NHS an amazing place to be cared for and looked after, wherever they're from. So just for our listeners and our viewers, where can they follow you? You're on social media now. You're getting bigger on the social channels. Where can they follow you?
X now, still. X. We have also got a LinkedIn and we're are we already on Instagram, or are we just about there? We're just about there.
Yeah. So what we'll do, we'll put in the links for your channels on our on this episode, so people can join and start following you on there. Thank you ever so much for joining us. Victoria, Mark, everyone, thank you ever so much. Again, if you've enjoyed today's episode, please don't forget to like and subscribe to us wherever you follow and listen to us. And as always, remember, we are all humans before our professions. So if you're going to be anything, be human. Until next time, see you soon.